welcome into our next episode of In the Know with STLCO. I'm Elizabeth Isley, and I am joined today by Dr. Kanika Cunningham, the Director of the Department of Public Health, and we are so excited to sit down and talk with you and introduce you to St. Louis County.
Yeah, I'm excited to be here. So a little bit about me. I've been in this position since January. I am from St. Louis, so I get that a lot. From North County specifically. I did all of my training at St. Louis University, so I'm a true Billiken at heart. And I absolutely love St. Louis, and people often ask me, why didn't you leave and go somewhere else? And this is home, and when you understand the issues in your own home, you want to work on those issues. You want to advocate, be a part of those groups that's going to make a change and a difference. And so I never wanted to leave St. Louis, and I stayed here and did all of my work here. And so, super excited to be in this position and to continue to serve my community in this capacity.
So before joining St. Louis County, what did you do?
So I was practicing full-time as a family medicine physician. I was at Family Care Health Center, so I did full scope family medicine. So I did, it was a saying that one of my old mentors said to me, that family physician doctors, we take care of you from the womb to the tomb. And that's exactly what I did. So I did a lot with pregnant women and maternal care, newborn care. I also did a lot with substance use. So I was a huge advocate in the St. Louis region of integrating addiction care into primary care. And there's a shortage with treatment providers. And it's really important for primary care providers to kind of make up that need and feel comfortable just taking care of the whole body, the individual that you see before us, and not, always referring out. So I was a huge advocate in the St. Louis area for that. And as a result, I expanded that to care for pregnant women with substance use disorders. And that was first in St. Louis to do that on a primary care level. So practice full time and just really championing my academic career and my physician career. And here I am today.
And what made you choose to come to St. Louis County and lead this department?
Right, why the change? This was honestly, it was a once in a lifetime opportunity, and I've always had a passion for public health. I do have my master's degree in public health. So I was first introduced to what is public health and, epidemiology and all that stuff back then. I think eventually I wanted to go into public health. I didn't know it was going to come this soon in my career. But when I look over my career, I think a lot of the community outreach, advocacy, data collection, I was doing things in the public health sector anyways while I was practicing full time. And it just made sense that when this opportunity presented itself, why not, take it. The other thing, the city health director, we're good friends. So it was also an opportunity for us to really collaborate for the region, not just only St. Louis County. And I just thought it was a great opportunity to be able to do that. So thank you, Dr. Page.
Nice. So what is your vision as the leader of this department?
So I have three main priorities. There's little priorities underneath that. But the biggest thing is really leading with equity. And what does that mean in today's time? There's a lot, I think, over the last few years. Equity became a buzzword. Now everyone says that. But can we really get to the true meaning of leading with equity and making sure that equity is really embedded in our practices, our policies, our decision-making processes? So that's something that's a main priority. And internally, I want to make sure that my staff who's going out to represent DPH St. Louis County, that we are mindful of who we're caring for, who are we talking to, and making sure that we listening to the voices that matter, and then bringing information back to the health department so we can continue to champion great efforts in the community. So that's one main thing, really embedded internally so that it can reflect externally, leading with equity. The second thing, we're still in a overdose crisis in the region. And so that's something that I am really passionate about, really undoing the stigma, increasing access to treatment and recovery resources, but then also just treating the individual with respect and care, no matter if they're actively using or not. How can we still keep them alive? And so internally with DPH, they already were doing really, really great work before I came here. So I want to expand what we're currently doing internally as well as externally, and then continuing to work with our community partners. So there's a lot of work that has been done, but there's a lot more that we can do to really, make a significant change and turn what we're seeing in the community. So that's my other big goal. And then lastly, workforce investment. So unfortunately, with the pandemic, public health departments all throughout the country were hit hard. You didn't really see people elevating the voices of public health and lifting them up, or even the physicians and nurses who were doing this work. Unfortunately, it was highly politicized. It was a lot of, mixed opinions, a lot of myths, a lot of messaging. We really highlighted the issue of a lot of inequities in the community. And so workforce investment, what does that mean, post-pandemic, or, in this time after coming out of a rough time for the entire country? How could we invest in public health? It is traditionally underfunded, but we do so much to care for the community. How can I let the community know that this is, public health do more than COVID-19, but how can I invest in those employees who may be burned out and stressed from everything that took place, but then also really build those community connections again with our partners who trust us before, but how can we rebuild that trust? So workforce investment, which will lead to community investment.
But you just led me into my next question, which is, I think a lot of people think of public health as COVID-19. And you and I know that it is much more than that. And so can you talk to, we can kind of go through, because there's so much stuff that the Department of Public Health does. So, I don't know, where do you want to start?
Yeah, so let's talk all things public health. So we do a lot. The first thing I would say, St. Louis County, we are the only health department in which we have our own clinics. So we provide care for residents of St. Louis County. We have 3 health centers, 2 located in North County, 1 that's in South County. Additionally, we provide the medical care at the jail. A lot of times with jails, the medical care is privatized, and so we're keeping that inside at DPH. So it's nice to be able to have our own clinic so we can integrate what we do with public health, but it also truly connect people to care, to seeing physicians, nurse practitioners. It's an exciting opportunity for St. Louis County and for our health department to be able to have access to clinical services in addition to public health services. One thing I will say with the clinics, was going to be a big transformation, is that we're currently going through the process of becoming what's called a federally qualified lookalike. So that will allow us to be recognized by a federal entity to receive additional funding so we can improve our quality of care. We can, we can continue to do the work that we are doing, but being recognized on a federal level for that. So that's something that's really exciting that we're doing.
So does that mean somebody, if I need a dentist, I can come to a public health clinic in St. Louis County and receive dental services? Like, what does that exactly mean?
Yep, we do offer dental services. So let's say you're looking for a primary care doctor, family medicine, internal medicine. You need GYN services, so women's health services. Your kids need to be seen for pediatric visits. Yes, you can come to the health department to schedule a new patient appointment and have your care here. If you need to see a dentist, we do have dental clinics and corrections as well as all throughout our clinics. So if you need to, get the cavity taken care of or just get your teeth clean, you can come see us. And I think that's something that's really unique. And then while you're here, we have a lot of public health programs that we can integrate into the clinics that we can connect people to while they're here as well.
And does it matter if I have health insurance or not?
It actually does not matter. I think that's something that people, they think I need to have health insurance. It doesn't matter. We will take care of anyone who come through the door. And I think that's something too that, they were doing that beforehand, but I'm really, really passionate about making sure people have access to quality care, not just access to care, but quality care and equitable care as well. And so it does not matter. Make an appointment. Come see us.
Right. So we've talked about clinical services.
Yes.
And that's one, segment of
public health. Yes.
We've got environmental services.
Yes.
Can you speak
Let's
to
talk
that?
about that. Yes. With our environmental, so one thing people may not think about is that we do the food inspections for all St. Louis County restaurants. So not just those in unincorporated St. Louis County, from McDonald's all the way to your high-end restaurants, we do the inspections. And so,
and you see that grade on the window.
Yes, you see
right?
the grade. Pay attention to the grade. But with that, we do the inspections to make sure that as you're, visiting these restaurants, that you're getting served quality food, that they're following proper processes for storage and for prepping the food. And then we do a series of checks throughout the year to make sure they're continuing to follow that. So while you're sitting down having your meal, you can think about the health department. But people don't often, they don't think about that we do that. Other things with environmental, mosquitoes. So unfortunately, we're in mosquito season right now. We monitor to make sure that mosquitoes are not carrying any type of vector-borne diseases. So we do surveillance. We also would treat, ponds and gutters to make sure we can get rid of the larvae before they become adult mosquitoes. And then if we do identify a problem, we can also treat adult mosquitoes with insecticides to make sure we can, make sure that people can frequent parks or wherever place they want to go, free of the concern of, oh, I got bit by a mosquito. Am I at risk for a vector-borne illness? So we also do that as well for the city. For the county, sorry, not for the city, for the county. If you go to a big county event, we actually go out and spray before somebody, like a concert. So, you may not think about, oh, there's no mosquitoes. That's because the health department, we went out and we sprayed. So those are just some things that we do that people don't think about. And we've been doing it before the pandemic, but it's nice to highlight some of the things that we're doing to serve the community.
And Dr. Cunningham, we have covered a lot of topics.
We have. And that's not even like everything, but no, there's a little bit about public health and what we do. And as you can see, I am super excited about this opportunity. And I look forward to the regional partnerships. I look forward to really making some significant transformational changes at the health department.
Well, thank you so much for joining us. And I'm sure we're going to talk to you again about some other great initiatives that you have going on.
Yes.
Thank you.